So we're going to talk about some endocrine metabolic disorders. The first of which is diabetes mellitus, which is a disease in which the body can't produce or use insulin effectively. This affects about 7.8% of the US population, which is roughly 29 million people. And another 86 million people have prediabetes, with 9 out of 10 unaware that they have the condition. The risk for death among diabetics is nearly twice that of non diabetics of the same age, and there are two types of diabetes, type 1 and type 2. This is just a chart that shows normal blood glucose levels and what they would be briefly after eating a meal, after fasting, and when it's random or unplanned. So type 1 diabetes used to be called insulin-dependent diabetes mellitus, and this is the body's inability to produce insulin. This is about 20% of the total number of cases of diabetes, which usually happens in people under the age of 20. Type 2 was non-insulin dependent diabetes mellitus, which is the remaining 90% of cases. And this is the body's inability to effectively use insulin. So this can be as a result of resistance to insulin and an overall decrease in insulin production. So it can be some combination of that. It's not always related to obesity, but most often it is. And this is just demonstrating the use of what I said earlier, the blood stick method, the glucometer. So there's a finger prick, and then using the test strip to measure the amount of sugar in the blood. Just as a note, in athletes with diabetes, the athletes with type 1 diabetes need to carry their testing strips and a glucometer to measure their blood sugar levels. They should also carry their own insulin and know what their blood sugar level is before competition. Ideally, you want it to range from 120 to 180, but injuries that happen in athletes can be particularly more dangerous, or they can be more aggravated as a result of having diabetes. So those common athletic wounds like blisters and calluses, they really need more diligent care because in a person with diabetes, these wounds heal more slowly, and you want to make sure that they are, healing as they should. So an exam for diabetes, you want to look at a variety of things. Are they thirsty? Are they going to the bathroom a lot? Has there been weight loss? Are they sweating? Any confusion, lethargy? Has there been any loss of consciousness? And then, look at some of those same things in the physical exam. So do they have sweating? Do they have that fruity breath? Are they obese? Do they have foot ulcer? Of particular note for eye exam changes is looking at diabetic retinopathy. And the main reason that people with diabetes are encouraged to have regular eye exams is to look for changes in the blood vessels of the retina that could indicate this diabetic retinopathy. And the early changes in the blood vessels they're kind of considered background retinopathy. And oftentimes it is the eye doctor who is the first to identify the presence of diabetes. And this is true in my own family. My father didn't know he had diabetes. He went for a regular eye exam, and the diabetic retinopathy was identified by his eye doctor, who sent him to see his GP for a workup to determine if he had diabetes, which he did. So it's one of those early detection signs that you want to make sure that you follow up with your eye doctor. Another disorder is hyperthyroidism. Hyperthyroidism is a hypermetabolic state caused by extra production of the thyroid hormones in the thyroid glands. Much more prevalent in women than it is in men, as you can tell by that prevalence rates. Also called Graves' disease, which is an autoimmune disorder characterized by diffuse toxic goiter, which is an enlargement of the thyroid gland. So you may have heard of the word goiter before, but that is an enlargement of the thyroid glands. These people tend to also have puffy eyes. There is a familiar predisposition to this disorder. And in getting the history, you want to look at things like, do they have an increased core body temperature? They have a higher heart rate? Do they experience palpitations, any tremors, anxiety or restlessness? Have they lost weight without trying to lose weight? And this tends to be treated with anti-thyroid medications. On the opposite end is hypothyroidism, which is caused by a thyroid hormone deficiency, also more prevalent in women and more prevalent as you get older. So again, clearly it says it's important to note that it's a metabolic condition caused by a thyroid hormone deficiency because it's on here twice. More prevalent in women is on here twice. Oh, look at that. So for history, you want to look at, do they have a cold intolerance? Have they gained weight without a reason for gaining weight? Do they have slow speech, slow cognition? And this is also treated with thyroid medications. Addison's disease is another endocrine disorder. It is adrenal insufficiency. It's a rare disorder that affects men and women of all ages, and it's known as adrenal insufficiency. And this develops when the adrenal glands don't produce enough cortisol. And it can be a problem related to the adrenals or a problem with the signal that the brain sends to the adrenals, telling them to make the cortisol. So symptoms of Addison disease include weakness, fatigue, abdominal pain. They can have some nausea, unexplained weight loss, low blood pressure, darkening of the skin, dizziness when standing up. There may be some depression. Symptoms tend to develop slowly and progress slowly, but it can be exacerbated by stressful events, can cause some of the symptoms to increase or worsen. Treatment usually involves replacing the cortisol that the body isn't producing or isn't producing enough of. And that's generally replaced with an oral synthetic glucocorticoid, which is, as I said, a synthetic medication. So sometimes they'll have to, in periods of stress or sickness, they may have to increase their medication because cortisol is an important hormone for your body in periods of stress and sickness. So they might need to increase the levels at some point. So again, with taking a history here, you want to look at depression, nausea, have they had any joint or muscle pains? Salt craving is typical with Addison's disease, low blood sugar, any skin changes or dehydration. Cushing syndrome was developed, actually first identified in 1932 by a doctor named Harvey Cushing, hence the name. And he identified 8 patients who had the main characteristics that have become associated with Cushing syndromes. And that is a central body obesity, as you can see in the pictures here, a glucose intolerance, hypertension, high blood pressure, excess hair growth in areas that may not be typical for hair growth, osteoporosis, kidney stones, some menstrual irregularities, and emotional lability. So they tend to be kind of emotionally flat. So those symptoms have become to be associated with Cushing syndrome. So this again is also related to excess production of cortisol by the adrenal glands. And it could be related to a tumor in the pituitary of the adrenal glands. It's kind of rare, but it can be related to also to some lung cancers. Just because a person has some of these characteristics doesn't mean that they have Cushing syndrome. But cortisol production by the adrenal gland is normally under control of the pituitary, So overproduction can be caused by a tumor in the pituitary or with the adrenal glands. So when they test for Cushing's syndrome, they look at the amount of cortisol excreted by the person over a 24-hour period. So, as stress levels fluctuate throughout the day, the cortisol that is secreted will fluctuate without the day. So they want to take a 24-hour average. So they'll do this and then tend to repeat this test to look at what variability is there and look for an average. Once the diagnosis is made, they tend to go have CAT scans, or MRI or ultrasound, looking for if the possibility of any tumors in the glands. So the treatment will depend on what the cause is. If it's a tumor, it may be surgical. It could also be radiation is used as a treatment, etc. Okay, so we're going to look at some systemic disorders, which are disorders affecting multiple parts of the body or the whole body, and not related to specific parts or organs. And the first one is non-Hodgkin's lymphoma, which is a cancer that originates in the lymphatic system, which, as you know, is the disease-fighting network throughout your body. So in non-Hodgkin's lymphoma, tumors develop from lymphocytes, which is a type of white blood cell. It's more common than Hodgkin's lymphoma, which we're going to talk about next. And there are lots of different types of non-Hodgkin's lymphoma. Some of the symptoms include some painless swollen lymph nodes in the neck, the armpits, or the groin, some abdominal pain or swelling, chest pain, coughing, trouble breathing, persistent fatigue, some fever, maybe night sweats, and an unexplained weight loss. On the physical exam, the doctor will check for swollen lymph nodes, including the neck, the underarm, and the groin area, and also check for a swollen spleen or liver. Blood tests and urine tests are also used, but generally to help rule out whether another infection exists. X-rays or MRIs, CT scans may also look for tumors in the body. Lymph node biopsy might be done, or a bone marrow test to determine whether this is non-Hodgkin's lymphoma or something else. So after the doctors determine that a person has non-Hodgkin's lymphoma, the cancer is assigned a stage, and it helps, knowing the stage helps be able to determine the prognosis and potential treatment options. So in stage 1, the cancer is limited to one lymph node region or group of nearby nodes. In stage 2, it's in 2 lymph node regions, or it has invaded another organ or nearby lymph node, but the cancer is still limited to a section of the body, either above or below the diaphragm. In stage 3, the cancer moves to lymph nodes both above and below the diaphragm. Can also be found in the lymph nodes above the diaphragm and in the spleen. And in stage 4, which is the most advanced stage, the cancer cells are in several portions of one or more organs or tissues. This stage, it can also affect other body parts, such as the liver, the lungs, the bones, etc. So that's one way to classify. And then they also use the letters A and B to indicate whether the person is experiencing symptoms or not experiencing symptoms. And that can be A and B. A being they don't have any significant symptoms, and B being that they do. Treatment isn't always necessary. If it's slow growing, a wait and see approach is often taken. It can, progress very, very slowly and may not require treatment for years. If it's more aggressive, treatment might include chemotherapy, radiation, maybe a bone marrow transplant, or other drug therapy to help the body's immune system be able to fight the cancer.